How do you know if blood pressure changes need emergency stroke care? Imagine suddenly feeling confused, weak, or having trouble speaking, and at the same time noticing your blood pressure is extremely high or dropping rapidly. These signs can be serious and might mean you need urgent medical help. When it comes to strokes, blood pressure plays a crucial role in both the risk and the treatment. If your blood pressure is very high, especially if your systolic pressure is above 185 millimeters of mercury or your diastolic is above 110 millimeters of mercury, it can increase the chance of bleeding in the brain during stroke treatment. This is particularly important if you are being considered for clot-busting medicines called thrombolytics. Doctors need to lower your blood pressure carefully before giving these medicines to prevent bleeding complications. Sudden spikes in blood pressure during or right after a stroke can also be dangerous. This might signal a hypertensive emergency, which requires immediate attention to prevent further brain damage. Conversely, if your blood pressure drops suddenly, it can reduce blood flow to parts of your brain that are already struggling due to the stroke. This can make the injury worse and needs quick medical intervention to stabilize your blood pressure and ensure your brain gets enough blood. In cases where bleeding occurs inside the brain, known as an intracerebral hemorrhage, controlling blood pressure is vital. Medical teams often aim to keep blood pressure below 140/90 millimeters of mercury, or even lower in some cases, to prevent the bleeding from getting worse. Watch out for warning signs that blood pressure changes are serious. If you notice new or worsening symptoms like weakness, difficulty speaking, vision problems, a severe headache, or confusion, especially when your blood pressure is very high or unstable, seek emergency care immediately. Persistent blood pressure readings above the critical thresholds, particularly if you are being considered for stroke treatment, are also a red flag. Symptoms like chest pain, shortness of breath, or severe headache along with high blood pressure can indicate a hypertensive crisis that needs urgent attention. Managing blood pressure in stroke patients is tricky because high blood pressure is common and sometimes a natural response to keep blood flowing to the brain. Medical guidelines recommend lowering blood pressure only when it exceeds certain levels or if clot-busting treatments are planned. This careful approach helps avoid reducing blood flow too much and worsening the stroke. After the first day or so, controlling blood pressure becomes part of preventing future strokes, but it should always be tailored to each person's condition. In summary, if your blood pressure suddenly becomes very high or drops sharply during a stroke, especially if you notice new neurological symptoms, it's time to seek emergency medical help. Prompt evaluation and treatment can make a big difference in outcomes. Always follow your healthcare provider's advice for managing blood pressure and stroke risk. And if you or someone else shows signs of a stroke, don't wait. Call emergency services immediately.